If you're pregnant and feel like your body is changing in ways you don't fully understand, take a deep breath. You're not alone. Every heartbeat, every breath, every sensation you're experiencing is part of an extraordinary biological process designed to protect both you and your baby. In this video, I'll gently explain what's really happening inside your body during pregnancy, so you can feel informed, confident, and reassured at every stage of this journey. And if this kind of clear, science-based support brings you peace, don't forget to like this video, subscribe to the channel, and join our growing community of parents walking through pregnancy together. Pregnancy is not a random sequence but a deeply organized transformation guided by biology. From the moment conception occurs, the body begins adjusting multiple systems at the same time, each one playing a specific role in sustaining new life. These changes do not happen by accident. They follow patterns refined through human evolution to prioritize safety, nourishment, and balance. Every organ participates in this adaptation. The heart adjusts its rhythm, the lungs modify breathing patterns, the digestive system slows its pace, and the immune system recalibrates its defenses. Rather than functioning independently, these systems communicate constantly through hormones and signaling molecules to ensure that mother and baby remain. It's common for pregnant individuals to feel surprised by how many sensations appear early on. Fatigue, warmth, emotional shifts, or subtle physical discomforts are often signs that the body is responding exactly as it should. These sensations are signals of coordination, not failure. Understanding pregnancy as a coordinated process helps reduce fear. When symptoms are viewed as purposeful adaptations rather than problems, many worries soften. The body is not losing control. It is actively building a safe environment for growth. One of the most remarkable aspects of pregnancy is how quickly these adaptations begin. Even before many people realize they are pregnant, the body is already changing blood flow, hormone levels, and immune activity. This early preparation ensures that implantation and early development occur in a stable environment. Hormones act as messengers, traveling through the bloodstream to signal what needs to adjust next. Progesterone supports the uterus, estrogen influences circulation, and HCG confirms the pregnancy's progression. Each hormone has a specific role, and together they orchestrate balance rather than chaos. Because these changes happen system-wide, it's normal to feel different, even in subtle ways. Sensitivity to smells, emotional shift, or altered sleep patterns often appear early. These experiences are signs that the body is prioritizing energy toward adaptation. When viewed through this lens, early pregnancy symptoms are not random inconveniences. They are evidence of a body that has recognized pregnancy and is responding with precision and care. As pregnancy progresses, the body continues refining its adjustment. The uterus expands gradually, organs shift to make space, and circulation increases to supply the placenta. Each change occurs in phases, allowing the body to adapt without overwhelming itself. This gradual pacing is intentional. Sudden changes would be stressful, but slow transitions allow tissue, muscles, and blood vessels to stretch and strengthen over time. This is why many changes feel progressive rather than abrupt. Muscles and joints become more flexible as hormones signal relaxation. While this can sometimes cause discomfort, it also prepares the body for childbirth. These adaptations increase mobility and reduce resistance where expansion is needed. Recognizing that discomfort can coexist with purpose helps restore confidence. Feeling different does not mean something is wrong. It often means the body is doing exactly what it was designed to do. The coordination of pregnancy also includes protection. While energy is directed toward the baby, the mother's body remains a priority. This balance ensures that maternal health is preserved while supporting fetal development. Blood volume increases to improve oxygen delivery, but it does so gradually to avoid strain. The heart works more efficient, not reckless. These changes highlight how pregnancy enhances function rather than weakening. Even the immune system adapts with precision. Instead of simply turning down, it changes strategy, allowing tolerance of the fetus while maintaining defense against infection. This intelligent recalibration protects both lives simultaneously. Understanding this balance can be deeply real. Pregnancy does not compromise the body's intelligence, it amplifies. Every adaptation during pregnancy has a reason rooted in survival and nourishment. When digestion slows, it allows for greater nutrient absorption. When breathing patterns shift, it ensures oxygen reaches both mother and baby effectively. These changes may feel unfamiliar, but unfamiliar does not mean unsafe. The body constantly monitors internal conditions and adjusts accordingly, using feedback systems that operate beyond conscious awareness. Many people worry that symptoms indicate something is wrong. In reality, most common pregnancy sensations reflect successful adaptation rather than dysfunction. Learning to trust these processes helps reduce anxiety and fosters a sense of partnership with the body instead of resistance. Pregnancy also teaches the body works on timelines that cannot be rushed, adjusting gradually to increasing demand. This pacing allows strength to build where needed and flexibility where required. Rest becomes essential, not because the body is weak, but because it is working intensely behind the scenes. Fatigue is often a sign of active transformation rather than decline. Supporting these changes through hydration, balanced nutrition, and rest helps the body maintain harmony. Small daily choices reinforce the larger biological process, seeing rest as productive rather than passive reframes pregnancy as a time of purposeful care. The coordination of pregnancy is dynamic, not static. Needs change from trimester to trimester, and the body responds accordingly. What feels challenging in one stage may ease in the next. This adaptability allows the body to handle increasing demands without collapse. It also explains why symptoms fluctuate rather than remain constant. Understanding that variation is normal prevents unnecessary worry. Pregnancy is not meant to feel the same every day. The body adjusts continuously, fine-tuning its responses as growth progresses. Another reassuring aspect of pregnancy is reversibility. Many adaptations are temporary, designed specifically for gestation and birth. As pregnancy nears its end, some systems begin preparing for recovery, even before delivery. Hormonal shifts initiate transitions that help the body return toward its baseline after birth. This demonstrates foresight built into the biological design. Pregnancy is not a one-way transformation. It is a cycle of adaptation and restoration. Knowing that the body plans for recovery can bring comfort and confidence. Viewing pregnancy as a coordinated process changes the emotional experience as well. Instead of fearing changes, many begin to feel awe toward what the body is accomplishing. This perspective encourages compassion toward oneself during moments of discomfort or uncertainty. The body is not failing, it is adapting. Each symptom tells a story of coordination and care, even when it feels inconvenient. Understanding brings empowerment, replacing fear with trust. At its core, pregnancy reflects biological intelligence working at its highest level. Every system collaborates to sustain life while preserving balance. No two pregnancies look exactly the same, yet the underlying coordination remains consistent. This flexibility allows individuality within structure. Trusting this process does not replace medical care, but it complements it by reducing unnecessary fear. Pregnancy is not simply change. It is intentional, guided transformation. Shortly after implantation, the pregnant body faces a remarkable biological challenge. The embryo carries genetic material that is not identical to the mother's, which under normal circumstances would trigger an immune response. Instead of attacking, the immune system adapts, recognizing that protection, not rejection, is required. This process is not a simple shutdown of immunity. Rather, it involves a refined recalibration in which certain immune cells reduce inflammatory reactions while others actively support pregnancy. This balance allows the mother's body to remain protected while welcoming the developing baby. Many people mistakenly believe pregnancy weakens immunity entirely. In reality, the immune system becomes more selective and responding differently depending on. Understanding this early adaptation can be reassuring. The body is not it is making intelligent adjustment from the very beginning. The immune system consists of many specialized cells, each with distinct roles. During pregnancy, these cells communicate constantly, adjusting their behavior to maintain harmony between maternal health and fetal development. Some immune cells become more tolerant, allowing the fetus to grow undisturbed. Others remain vigilant against infection, ensuring that the mother continues to be defended from harmful pathogens. This selective protection highlights how advanced the immune system truly is. Rather than choosing between mother and baby, it supports both simultaneously. These early immune changes often occur silently, without noticeable symptoms, yet they are essential to sustaining pregnancy. One of the most important immune adaptations during pregnancy occurs at the uterus. Specialized immune cells gather around the implantation site, creating a supportive environment for placental development. These cells help regulate blood flow, reduce inflammation, and protect the fetus from immune attack. Their presence shows that the immune system actively contributes to building a safe space for growth. At the same time, a protective mucus barrier forms at the cervix, preventing bacteria from entering the uterus. This physical defense works alongside immune adaptations to reduce infection. Together, these mechanisms form a multi-layered system of protection designed specifically for pregnancy. Hormones play a key role in guiding immune changes. Progesterone, estrogen, and other pregnancy hormones send signals that influence how immune cells behave. These hormonal messages help shift the immune system toward tolerance without eliminating its ability to respond to threats. This balance is delicate and highly regulated. Because of these changes, some pregnant individuals may notice differences in how their body responds to illness or inflammation. These variations are often normal and reflect immune adaptation, rather than indicating weakness. These responses show that the immune system is operating under a new, pregnancy-specific strategy. The immune system's adaptability also explains why pregnancy symptoms vary widely. Each body responds uniquely to immune and hormonal shifts, creating a wide range of normal experience. Some may feel more sensitive to environmental factors, while others noticed very few changes. Both experiences can fall within healthy pregnancy ranges. This variability can sometimes cause worry, especially when comparing experiences with others. However, diversity in immune responses is expected and natural. Pregnancy does not follow a single immune blueprint. It allows flexibility while maintaining protection. As pregnancy progresses, immune adaptations continue to evolve. Early pregnancy favors tolerance to support implantation, while later stages gradually prepare the body for labor, and these shifts ensure that the immune system remains responsive to changing needs throughout gestation. The body constantly reassesses priorities and adjusts accordingly. This dynamic process highlights that immune adaptation is ongoing, not fixed. It responds to each phase of pregnancy with precision. Understanding this progression can help explain why certain symptoms appear or fade over time. Importantly, immune adaptation during pregnancy is temporary. After birth, the immune system gradually returns to its pre-pregnancy state. This reversibility shows that the immune system is flexible, capable of entering and exiting pregnancy mode as needed. The transition does not happen overnight, but rather through gradual, hormonal, and physiological shifts after delivery. Knowing that immune changes are not permanent can bring comfort and reassurance. Research into pregnancy immunology is still evolving. Historically, much focus has been placed on the fetus, while the mother's immune experience received less attention. New studies are revealing how complex and intelligent these immune changes truly are. Each discovery helps improve understanding and care. As knowledge grows, so does the ability to support pregnant individuals more effectively when immune-related complications arise. This progress reflects a growing appreciation for the mother's biology during pregnancy. Viewing immune adaptation as protective rather than problematic reframes many pregnancies. The body is not compromising safety, it is redefining it. This understanding encourages trust in the body's capacity to manage complex biological demand. Fear often comes from misunderstanding, and knowledge replaces fear with confidence. The immune system is not stepping back. It is stepping into a new role. Pregnancy reveals the immune system's remarkable intelligence and flexibility. It balances tolerance and defense with extraordinary precision. Each immune adjustment supports a larger goal, sustaining life while preserving maternal health. These changes are not signs of vulnerability, but of strength expressed in a different form. Pregnancy does not weaken immunity, transforms it with purpose. Hormones act as the primary messengers of pregnancy, guiding the body through every stage of adaptation. From the earliest weeks, hormonal signals begin coordinating changes that allow the pregnancy to develop safely. These signals do not appear randomly. They follow a carefully timed sequence. Progesterone, relaxin, and HCG each have distinct roles. Together, they influence muscle, digestion, circulation, and even emotional regulation. Their combined effect ensures that the body adjusts gradually rather than abruptly. Many early pregnancy symptoms are directly linked to these hormonal shifts. Nausea, fatigue, and digestive changes often emerge as the body responds to rising hormone levels. Recognizing hormones as guides rather than disruptors helps explain why these sensations are both common and expected. Human chorionic gonadotropin, or HCG, is one of the first hormones to increase rapidly in early pregnancy. It supports the maintenance of the uterine lining and signals that pregnancy is progressing normally. This rapid rise is also associated with nausea and vomiting, commonly known as morning sickness. Despite the name, these symptoms can occur at any time of day. While uncomfortable, nausea often reflects strong hormonal signaling rather than a problem. For many, it peaks in the first trimester and gradually eases as hormone levels stabilize. Understanding the role of HCG can help reduce anxiety when these symptoms. Progesterone plays a central role throughout pregnancy. One of its main functions is to relax smooth muscle, allowing the uterus to expand without resistance. This relaxation also affects other systems. When digestive muscles slow down, food moves more slowly through the intestine, which can lead to constipation and bloating. Progesterone also relaxes the muscle at the top of the stomach, making it easier for acid to move upward and cause heartburn or reflux. These effects are not signs of malfunction, but predictable outcomes of progesterone doing its job. Relaxin, as its name suggests, helps loosen ligaments and joints. This hormone prepares the pelvis and surrounding structure for childbirth. While this flexibility is essential, it can also lead to sensations of instability or joint discomfort. Some people notice changes in posture or mild aches as joints adapt. Relaxin's effects extend beyond the pelvis, influencing connective tissues throughout the body. This widespread action supports growth and expansion. Awareness of relaxin's role helps explain why the body may feel different in movement and balance. Hormonal changes also influence appetite and food preference. Cravings and aversions often reflect shifts in metabolism and sensory. Smell and taste sensitivity may increase, making certain foods suddenly appealing or intolerable. These changes can happen quickly and vary from day to day. Rather than being purely psychological, these responses are driven by hormonal effects on the nervous system. Understanding this connection helps normalize experiences that might otherwise feel confusing. Hormones also affect energy levels. Early pregnancy fatigue is common as the body redirects resources toward building the placenta and supporting growth. Progesterone has a calming effect on the nervous system, which can increase the need for rest. This is not weakness, but a signal to slow down during intense internal work. As pregnancy progresses, energy often returns as the body adapts to its new hormonal environment. Listening to these signals supports overall well-being during pregnancy. Emotional changes during pregnancy are also influenced by hormones. Mood fluctuations can occur as hormone levels rise and fall. These emotional shifts are part of neurological adaptation as the brain responds to new chemical signals. They do not indicate instability or loss of control. Many people find that emotions become more intense or more accessible during pregnancy. This sensitivity often reflects deeper emotional processes. Recognizing the hormonal influence reduces self-judgment and promotes compassion. As pregnancy advances, hormonal patterns shift again. Some early symptoms, while new sensations emerge. This transition reflects the body reaching new stages of adaptation. Hormones adjust their levels to meet changing needs. Each trimester brings a different hormonal balance, shaping the physical and emotional experience. Change over time is expected and reflects ongoing coordination. Importantly, hormonal effects are temporary. After birth, hormone levels gradually return toward their pre-pregnancy. This reversal allows systems like digestion, circulation, and joint stability to recover. While the transition takes time, the body is designed to adapt both into and out of pregnancy. Knowing this can bring reassurance during moments of discomfort. Hormones are not the cause of chaos in pregnancy. They are the architects of adaptation. Each symptom they produce has a biological explanation and purpose. Understanding these roles transforms symptoms into meaningful signals rather than sources of fear. Pregnancy becomes easier to navigate when changes are expected instead of alarming. Hormonal guidance is one of the body's most powerful tools for sustaining life. As pregnancy progresses, the growing uterus gradually moves upward and outward to make room for the developing baby. This expansion gently shifts nearby organs, including the diaphragm, the main muscle responsible for breathing. These movements are slow and intentional, allowing the body time to adapt. When the diaphragm has less space to move downward, the lungs cannot expand in exactly the same way as before. This does not mean oxygen delivery becomes inadequate. Instead, the body adjusts how breathing works to maintain balance. Breathing may begin to feel different, even early in. Some people notice deeper breaths, while others feel shortness of breath during routine activities. These sensations are often normal signs of adaptation rather than indicators of danger. Hormones play an essential role in respiratory changes. Progesterone acts as a natural respiratory stimulant, signaling the brain to increase breathing rate. By breathing slightly faster or more efficiently, the body compensates for reduced lung expansion. This ensures that oxygen levels remain sufficient for both mother and baby. This adjustment happens automatically, without conscious effort. The body continuously monitors oxygen and carbon dioxide levels to maintain equilibrium. Feeling aware of breathing does not mean something is wrong. It often means the body is responding appropriately. Increased oxygen demand during pregnancy is normal. The developing baby relies entirely on the mother's circulation and breathing for oxygen supply. To meet this demand, the body improves oxygen transport through both increased blood volume and altered breathing pattern. These systems work together seamlessly. Breathing, circulation, and placental exchange coordinate to support fetal growth. Understanding this teamwork helps explain why changes in breathing are purposeful rather than problematic. Shortness of breath can feel unsettling, especially for first-time parents. However, in most healthy pregnancies, it reflects normal physiological adjustment. Breathing may feel more noticeable during physical activity, climbing stairs, or lying flat. These sensations often fluctuate throughout the day. Rest, posture, and slow breathing can help ease discomfort. Listening to the body is important. Recognizing these sensations as adaptive responses can reduce fear and anxiety. As pregnancy advances, posture naturally changes to accommodate the growing uterus. This can also influence how the chest expands during breathing. Standing or sitting upright often allows the lungs to expand more comfortably. Slouching may increase the sensation of breathlessness. Simple awareness of posture can make breathing feel easy. Small adjustments often have noticeable effects. The body constantly seeks positions that optimize comfort and function. Later in pregnancy, some people notice increased breath awareness even at rest. This is often due to continued uterine growth and sustained hormonal influence. Despite this awareness, oxygen levels typically remain well within healthy ranges. The body prioritizes oxygen delivery above many other functions. Medical providers monitor breathing and oxygenation as part of routine prenatal care, ensuring safety throughout pregnancy. Trusting this oversight helps reinforce reassurance during moments of concern. Interestingly, breathing often becomes easier again shortly before birth. As the baby descends into the pelvis, pressure on the diaphragm. This shift allows the lungs to expand more fully, offering a sense of relief. Many describe this as being able to breathe better again. This change signals that the body is preparing for labor and birth. It highlights how pregnancy adaptations are dynamic and responsive. Breathing changes during pregnancy also support relaxation and emotional regulation. Slower, deeper breaths can calm the nervous system. Many find that focusing on breathing brings a sense of control during physical discomfort. These skills often become valuable during labor, where breathing supports pain management and focus. Pregnancy naturally teaches awareness that extends beyond physiology. Understanding respiratory changes helps distinguish normal sensations from warning signs. While most breathing changes are expected, sudden or severe symptoms should be evaluated. This knowledge empowers pregnant individuals to trust their bodies while also recognizing when to seek care. Confidence grows when information replaces uncertainty. Breathing changes are part of adaptation, not failure. Pregnancy reshapes breathing patterns with intention and care. Each adjustment ensures that oxygen continues to reach both mother and baby efficiently. These changes reflect the body's ability to solve complex challenges automatically. Breath awareness during pregnancy is a sign of cooperation between systems, not limitation. The body adapts with precision, protecting life with every breath. During pregnancy, the cardiovascular system undergoes one of its most significant transformations to support the placenta and the growing baby. This change begins early and continues gradually throughout pregnancy. More blood means more oxygen and nutrients can be delivered where they are needed most. The placenta depends on this increased circulation to function as the baby's lifeline. These changes are carefully regulated. The body does not simply add blood. Without preparation, it expands vessels and adapts heart function to manage the increase safely. Understanding this process helps explain why the heart feels more active during pregnancy. As blood volume rises, the heart responds by pumping more frequently. A higher heart rate is a normal adaptation that helps move blood efficiently through the expanded circulatory system. Many pregnant individuals notice their heartbeat more easily, especially during rest or mild activity. This awareness can feel unfamiliar, but it often reflects healthy adaptation. The heart muscle itself becomes stronger and more efficient during pregnancy. Rather than being strained, it adjusts to meet new demands. These changes support both maternal health and fetal growth simultaneously. Blood volume during pregnancy can increase by 50% or more. While this sounds dramatic, it occurs slowly, allowing the body to adapt without shock. Although the total volume rises significantly, red blood cells increase at a slightly lower rate. This creates a natural dilution that helps blood flow smoothly through vessels. This dilution is normal and expected. It does not usually indicate a problem, but rather reflects efficient circulation. Medical providers monitor blood levels to ensure balance and adequate nutrient supply. The kidneys play an important role in cardiovascular adaptation. They retain additional water and sodium, helping expand blood volume. At the same time, the kidneys produce hormones that stimulate red blood cell production. This supports oxygen delivery as circulation increases. These kidney-heart interactions demonstrate how multiple systems coordinate during pregnancy. Each adjustment supports a larger goal of nourishment and protection. The placenta depends on constant blood flow to deliver oxygen and nutrients to the baby. Increased circulation ensures that this exchange remains efficient. Any disruption in blood flow can affect placental function, which is why the body prioritizes cardiovascular adaptation. The heart and blood vessels adjust to protect placental circulation, even as physical demands increase. This highlights the body's ability to prioritize essential systems. Some cardiovascular changes are noticeable, such as swelling in the legs or feet. This can occur when expanding blood volume and uterine pressure slow blood return from the lower body. Mild swelling is often normal, especially later in pregnancy. It reflects fluid shifts rather than failure of circulation. Elevating the legs and staying hydrated can help sensation. Understanding the cause helps reduce concern and promotes calm response. Blood pressure can change during pregnancy, sometimes decreasing slightly in mid-pregnancy before rising again later. These shifts reflect ongoing vascular adaptation. The body carefully balances vessel relaxation and blood volume to maintain adequate pressure. Because blood pressure is so important, it is monitored regularly during prenatal care. This monitoring ensures early detection of conditions that require attention. The cardiovascular system also begins preparing for birth well before labor begins. Increased blood volume provides a safety buffer for blood loss during delivery. This foresight highlights how pregnancy adaptations extend beyond gestation itself. The body anticipates future needs and adjusts in advance. These preparations support both safety and recovery. After birth, cardiovascular changes gradually reverse. Blood volume decreases, and the heart returns toward its pre-pregnancy workload. This transition takes time, reflecting the same gradual approach seen during pregnancy. The body shifts from support mode back toward restoration. Knowing this can reassure those concerned about lasting changes. Pregnancy reveals the heart's remarkable ability to adapt. Increased blood flow, heart rate, and vessel flexibility work together seamlessly. These changes are not signs of weakness, but of strength responding to greater purpose. The cardiovascular system rises to meet the demands of pregnancy with precision. Every heartbeat supports both mother and baby in quiet coordination. As pregnancy advances, the body continuously adapts to increased blood flow and physical changes caused by the expanding uterus. These adaptations can lead to temporary swelling, subtle shifts in blood pressure, and occasional shortness of breath. While these sensations may feel unfamiliar, they are often normal parts of healthy pregnancy physiology. Swelling, especially in the legs, ankles, and feet, commonly appears as gravity pulls fluid downward. Increased blood volume and fluid retention contribute to this effect, particularly later in the day. These changes usually develop gradually, allowing the body time to adjust. Sudden or severe symptoms should be evaluated, but mild swelling often reflects natural adaptation. Understanding the cause of these sensations helps transform concern into reassurance. Blood pressure behaves differently during pregnancy than at other times in life. Early and mid-pregnancy often bring a slight drop in blood pressure as blood vessels relax under hormonal This relaxation allows increased blood flow to the placenta and uterus without excessive pressure. Later in pregnancy, blood pressure may slowly rise again as demands change. These shifts are carefully monitored during prenatal visits to ensure they remain within healthy ranges. Regular monitoring helps distinguish normal adaptation from conditions requiring attention. Shortness of breath during pregnancy can be surprising, especially when it occurs during everyday activities. This sensation often results from the uterus pressing upward and limiting diaphragm movement. Hormonal stimulation of breathing helps compensate by increasing respiratory rate and efficiency. This ensures that oxygen delivery remains sufficient despite reduced lung expansion. Feeling breath-aware does not mean oxygen levels are low. It often reflects mechanical changes rather than respiratory compromise. Understanding this distinction can ease anxiety when breathlessness appears. The growing uterus can also press against large veins, slowing blood return from the lower body. This contributes to fluid accumulation in the legs, and standing or sitting for long periods may intensify swelling. Gentle movement and position changes often help improve circulation. Lying on the left side can relieve pressure on major blood vessels and support blood flow. Small daily adjustments can significantly improve fluid retention during pregnancy. Serves an important purpose. Extra fluid supports increased blood volume, placental circulation, and tissue expansion. This fluid also provides a reserve that becomes useful during labor and delivery. What may feel inconvenient often has protective intent. Swelling becomes more noticeable when the body has done its job efficiently. Viewing fluid retention as purposeful reframes discomfort with understanding. Changes in blood pressure and circulation can occasionally cause lightheadedness, especially after standing for long periods. This happens when blood pools in the lower body. Rising slowly, staying hydrated, and avoiding prolonged standing can help reduce the body's circulatory system is adjusting to new demands and position. Awareness of these triggers empowers proactive self-care. Breathing, circulation, and posture are deeply connected during pregnancy. As posture shifts, breathing patterns and blood flow respond. Supporting posture with proper seating and alignment can ease pressure on the diaphragm and blood vessel. Gentle stretching and prenatal movement help maintain circulation and comfort. These practices support the body's natural adaptation. Healthcare providers pay close attention to swelling, blood pressure, and breathing because they reflect cardiovascular and circulatory health. Most changes are benign, but monitoring ensures early detection of potential complications. This ongoing assessment provides reassurance that adaptations remain within healthy limits. Prenatal care acts as a safety net throughout pregnancy. Importantly, many of these changes begin reversing even before birth. As the baby descends into the pelvis, pressure on blood vessels and the diaphragm often decrease. Breathing may feel easier, and swelling can lessen as circulation. These shifts shifts signal that the body is preparing for labor and recovery. Adaptation is not static, it evolves toward restoration. Temporary swelling, blood pressure changes, and breath awareness reflect a body responding intelligently to pregnancy demands. These sensations are signs of adjustment, not failure. Understanding their purpose fosters confidence and calm. The body adapts continuously, protecting both mother and baby with remarkable precision. Pregnancy significantly increases the body's nutritional demands. As the baby grows, it relies entirely on nutrients from the mother's diet to build tissue, organs, and its own blood supply. This process begins early and continues throughout pregnancy. The mother's body prioritizes nutrient delivery to the developing baby. This prioritization is intentional and biologically protective, ensuring proper growth even when intake fluctuates. Because of this shift, the mother may feel increased hunger or fatigue. These signals reflect the body's request for additional fuel. Understanding this dynamic highlights the importance of consistent, balanced nourishment. Iron is one of the most critical nutrients during pregnancy. It supports red blood cell production for both mother and baby, enabling efficient oxygen transport. As the baby forms its own blood supply, iron demands increase substantially. This can leave the mother more susceptible to low iron levels if intake is insufficient. Iron from food is absorbed gradually, making daily intake especially important. Healthcare providers monitor iron levels to ensure both mother and baby remain well supported. Other nutrients, such as folate, vitamin B12, calcium, and protein, also play essential roles. Folate supports cell division and neural development, while calcium contributes to bone formation. Protein provides the building blocks for growing tissue, including muscles and organs. Increased protein needs reflect active construction within the body. Balanced nutrition does not require perfection, but rather consistency and variety. Each nutrient contributes to a complex system of growth and protection. Pregnancy can influence appetite and food tolerance, sometimes making balanced eating feel challenging. Nausea, aversions, or cravings may affect food. These experiences are common and often hormonally driven. The body adapts to changing needs and sensory responses. Small, frequent meals and flexible food choices can help meet nutritional demands. Understanding that these challenges are temporary can reduce frustration. Hydration is also a critical component of pregnancy nutrition. Increased blood volume and amniotic fluid require adequate fluid intake. Water supports circulation, digestion, and temperature regulation. Dehydration can intensify fatigue and discomfort. Listening to thirst cues and maintaining regular hydration supports overall well-being. Hydration works alongside nutrients to sustain pregnancy. The placenta plays a central role in nutrient transfer. It carefully regulates what reaches the baby, adjusting based on availability and need. This regulation helps protect the baby while maintaining maternal stability. Even when intake varies slightly, the body works to maintain balance. The placenta acts as an intelligent gatekeeper throughout pregnancy. Balanced nutrition also supports the mother's recovery after birth. Nutrient reserves built during pregnancy contribute to healing and breastfeeding. Pregnancy nutrition is not only about growth, but also preparation for postpartum demands. Supporting the body now lays a foundation for later stages. Nutrition is an investment in both present and future. Cultural, personal, and medical factors influence dietary choices during pregnancy. There is no single perfect diet that fits everyone. What matters most is meeting nutritional needs in a way that feels sustainable and supportive. Personalized guidance from healthcare providers helps tailor nutrition to individual circumstances. Flexibility and balance are key principles. Understanding rising nutrient demands helps explain why prenatal supplements are often recommended. They support, but do not replace, a balanced diet. Supplements help fill gaps during times of increased need or reduced intake. They work best when combined with nourishing food choices. Prenatal care integrates nutrition as a core component of health. Pregnancy transforms nutrition into a shared biological process. Every meal contributes to building new life while sustaining maternal health. This collaboration highlights the body's ability to allocate resources intelligently. Balanced nutrition supports energy, growth, and resilience. Nourishing the body is an act of care for both mother and baby. As pregnancy approaches its final stages, the body begins preparing not only for birth, but also for recovery. This preparation starts earlier than many people realize, with subtle shifts occurring weeks before labor begins. Rather than continuing in one direction, some pregnancy-related changes begin to soften or reverse. These transitions reflect the body's ability to anticipate what comes next. This forward planning helps ensure that birth and recovery happen safely and efficiently. Understanding this timing can bring reassurance as sensations begin to change. One of the earliest signs of this transition occurs when the baby gradually moves lower into the pelvis. This process, often called lightening, reduces pressure on the diaphragm. As pressure decreases, breathing may feel easier. Many notice an increased ability to take deeper breaths. This change can feel relieving after weeks of breath awareness. It signals that the body is aligning itself for labor. Hormonal patterns also begin shifting before birth. Certain hormones that maintained pregnancy gradually make space for those that support labor and recovery. These changes help prepare the uterus for contractions and the body for delivery. At the same time, systems such as digestion and circulation begin adjusting toward post-pregnancy. This overlap reflects a smooth, gradual transition rather than an abrupt shift. Fluid balance often changes as labor approaches. Some people notice a reduction in swelling as the body redistributes or releases excess fluid. This fluid shift helps prepare the body for the physical demands of birth. What once supported pregnancy now becomes a reserve for delivery. The body reallocates resources with precision. The uterus itself begins preparing for its role in labor. Muscle fibers become more responsive, and coordination. These changes are not sudden. They develop over time, allowing strength and efficiency to build. Preparation happens quietly, often without noticeable symptoms. This readiness supports a more effective labor process. Even before delivery, the body initiates healing mechanisms. Increased circulation to certain tissues supports resilience and repair. This early activation helps reduce recovery time after birth. The body does not wait until after delivery to begin healing, it prepares in advance. This foresight reflects biological intelligence. Emotional and mental shifts can also occur during this period. Some people report increased focus, nesting behavior, or heightened awareness. These changes are influenced by hormonal transitions and neurological adaptation. They support preparation, bonding, and caregiving readiness. Mental preparation complements physical readiness. After birth, many changes accelerate. Fluid loss during delivery and postpartum adjustments reduce blood volume and swelling. The uterus begins contracting back toward its pre-pregnancy size. Other systems gradually follow, returning toward baseline function. Recovery unfolds over weeks, not days. Understanding that reversal begins before birth reframes postpartum recovery. Healing is a continuation, not a new process. The body has already started. This perspective reduces pressure to bounce back quickly. Recovery is gradual and supported by design. Pregnancy is not only about growth, but also about transition. The body plans both forward and backward movement. Reversal and recovery are built into the pregnancy timeline. These changes reflect resilience and foresight. The body prepares for birth and healing with equal care. Pregnancy influences not only the body, but also the brain. These neurological changes begin during pregnancy and can continue into early parenthood. Rather than representing loss or decline, many of these changes appear to be adaptive. The brain reorganizes in ways that support caregiving and emotional connection. This adaptation reflects the brain's remarkable flexibility. Pregnancy reshapes neural pathways to meet new demands. Recent brain imaging studies have identified structural and functional changes following pregnancy. These differences are subtle but consistent. They often involve areas related to emotion, empathy, and social understanding. Such changes may help parents interpret nonverbal cues, such as facial expressions or cries. This heightened sensitivity supports bonding and responsiveness. Hormones play a central role in neurological adaptation. Shifts in estrogen, progesterone, and oxytocin influence brain chemistry. Oxytocin, often called the bonding hormone, strengthens emotional connection and trust. These hormonal effects prepare the brain for nurturing behavior. The emotional brain becomes more attuned to caregiving needs. Some pregnant individuals notice changes in memory, attention, or concentration. These experiences are sometimes labeled negatively, but they may reflect shifting priorities rather than impairment. The brain reallocates resources toward tasks related to safety, connection, and care. This focus can make other tasks feel less prominent. Understanding this reframes cognitive changes as adaptation. Emotional awareness often increases during pregnancy. Feelings may feel more accessible or intense. This sensitivity supports connection, empathy, and protective instincts. Rather than indicating emotional instability, these changes reflect neurological. The brain becomes more responsive to emotional signals. Stress processing also changes during pregnancy. The brain adapts to help protect the developing baby from excessive stress signal. Hormonal buffering systems help regulate stress hormone. This regulation supports emotional resilience. Pregnancy promotes balance rather than overwhelm. Neurological changes continue after birth, supporting caregiving and bonding. The brain remains flexible, adjusting to new routines and emotional demand. This plasticity supports learning and adaptation during early parenthood. Change continues beyond pregnancy. Historically, research focused more on fetal development than on the pregnant brain. This left gaps in understanding maternal neurological. New research is beginning to fill these gaps. Each discovery deepens a appreciation for maternal adaptation. Understanding continues to evolve. Viewing brain changes as adaptive reduces fear and self-judgment. The brain is not failing, it is transformed. This perspective encourages compassion and patience. Awareness replaces misunderstanding. Knowledge supports emotional well-being. Pregnancy highlights the brain's capacity for meaningful change. These adaptations support connection, care, and protection. The brain evolves alongside the body. Together, they prepare for the demands of parenthood. Pregnancy reshapes not just life, but the mind itself. No two pregnancies are exactly alike. Even in healthy pregnancy, experiences can vary widely in how symptoms change or resolve over time. These differences reflect individuality in genetics, environment, health history, and physiology. Variation does not mean something is wrong. It means the body is responding in its own way. Recognizing uniqueness helps reduce unnecessary comparison and anxiety. Historically, much pregnancy research focused primarily on the fetus, often overlooking the maternal experience. As a result, many aspects of pregnancy physiology were underexplored or poorly understood. Today, research increasingly centers on the pregnant body itself. This shift is expanding knowledge and improving care. New studies continue to reveal how complex and coordinated pregnancy truly is. Systems once thought to function independently are now known to work together closely. Understanding these interactions helps explain why symptoms can feel widespread and interconnected. This knowledge also improves early detection of complications. Science continues to refine what care should look like. Medical guidance plays a critical role in navigating pregnancy safely. Routine prenatal care monitors changes and identifies when support is needed. Healthcare providers interpret symptoms within context, distinguishing normal adaptation from concern. This partnership allows reassurance when things are normal and intervention when they are not. Personalized care supports both confidence and safety. Because pregnancy experiences differ, advice that works for one person may not suit another. Personalized care respects the medical history, lifestyle, and individual needs shape recommendations. This tailored approach supports better outcomes. There is no single right way to experience pregnancy. Ongoing research also helps reduce fear by replacing myths with evidence-based understanding. When information is accurate and accessible, anxiety decreases. Education empowers pregnant individuals to make informed decisions. Knowledge fosters trust in both the body and medical care. As research evolves, care practice, what is recommended today may differ from the past as understanding grows. This evolution reflects progress, not uncertainty. Medicine adapts just as the body does. Both respond to new information with intention. Consulting healthcare professionals provides clarity when questions arise. No concern is too small to discuss. Open communication strengthens the care relationship. This dialogue ensures that individual needs are addressed. Support is a cornerstone of healthy pregnancy. Trusting pregnancy does not mean ignoring warning signs. It means understanding what is normal while remaining attentive. Education supports balanced awareness rather than fear. Confidence grows when knowledge and care work together. Pregnancy becomes a guided journey, not a guessing process. Pregnancy is a dynamic experience shaped by biology, individuality, and science. Ongoing research continues to illuminate its complexity. Medical guidance ensures safety within this uniqueness. Every pregnancy deserves informed, personalized, and compassionate care.